What if the position you sleep in tonight is quietly setting up a stroke by morning? Neurologists and cardiovascular specialists are now sounding the alarm. One sleeping habit that feels completely harmless may be cutting off blood flow to your brain every single night while you're unconscious and completely unaware. Here's the number that keeps me up at night. 30% of all strokes happen between midnight and 6 a.m., not during exercise, not during stress, not during an argument. While you're lying still, eyes closed, thinking you're safe. And the terrifying part, the position you're sleeping in might be why. I'm Dr. Blake Harrison. I've spent years in cardiovascular medicine watching patients come in with stroke symptoms that trace back not to their diet, not to their genetics, but to what they were doing with their body for 8 hours every single night. In the next 15 minutes, I'm going to show you 5 sleeping positions ranked from bad to deadly. And then I'm going to give you 2 positions that could genuinely protect your brain starting tonight. Before we start, I need you to do one thing right now. Drop a comment below. Back sleeper, side sleeper, or stomach sleeper. Because in the next 60 seconds, I'm going to tell you whether your habit made this list. And if you're over 60, what I'm about to share is not optional information. This is urgent. Let's get into it. Number 5. Sleeping completely flat on your back with zero elevation. I know it feels natural. Spine is straight. Some people call it the correct way to sleep. But here's the biological reality that changes everything when you age. When you lie perfectly horizontal, blood pools toward your head. Gravity stops helping your circulatory system and starts working against it. In your 20s and 30s, your blood vessels are flexible enough to manage this. After 60, those vessels stiffen. The tiny arteries feeding your brain become fragile. And when blood pools in your skull for 7 to 8 hours straight, pressure builds inside your head. That's not just uncomfortable, that's dangerous. You know that pounding headache you wake up with at 3 in the morning? That's not random. That's intracranial pressure. Your brain is being compressed by excess blood volume that cannot drain properly while you're lying completely flat. Research published in the Journal of Clinical Sleep Medicine studied this exact mechanism. What they found was striking. Even a 15-degree elevation of your head measurably reduces this pressure and improves blood return to the heart. Something as simple as a slight incline changes the entire equation. Here's what people miss. Someone wakes up dizzy. They sit up too fast and feel lightheaded. They think, that's just aging. No, that's a warning signal that your blood flow dynamics during sleep are not working correctly. I'll give you the exact fix at the end. But first, you need to hear number 4, because this one surprises almost everyone. Number 4, sleeping on your right side if you have any history of heart disease, high blood pressure, or cardiovascular issues. This sounds oddly specific. But once you understand the anatomy, you'll never look at this position the same way again. Your heart sits slightly left of center in your chest. When you roll onto your right side, your body weight shifts, and the inferior vena cava, one of the largest veins in your entire body, gets compressed. That vein is responsible for returning blood from your entire lower body back to your heart. Even mild compression forces your heart to work harder to pull that blood back in. For a healthy 30-year-old, that extra effort is not a big deal. For someone over 60 with borderline heart function or elevated blood pressure, your heart is already working overtime just to keep up. Now add 7 hours of extra mechanical strain every single night, night after night, for years. The math is not good. Here's what cardiologists have observed clinically. Patients with heart failure instinctively avoid sleeping on their right side. It feels wrong. It's uncomfortable. That's not coincidence. That's your body communicating something critical. The European Journal of Heart Failure studied sleep positions in cardiac patients and found that left side sleeping was consistently associated with better blood flow stability and less overnight cardiac strain. This is not a minor detail. This is your heart working harder for 7 hours every night because of which direction you're facing. If you just commented right side sleeper, keep watching. Number 3 is going to apply to you too. Number 3, stacking 2, 3, or 4 pillows under your head. People do this for acid reflux, sinus drainage, breathing comfort, and yes, some elevation helps. But here's what excessive pillow stacking does that nobody talks about, and it involves blood flow directly to your brainstem. When too many pillows push your head too far forward, your neck bends dramatically. Running along both sides of your cervical spine are the vertebral arteries. These are critical vessels that supply your brainstem and cerebellum, the parts of your brain that control balance, coordination, and consciousness itself. When your head is forced into that forward bent position, these arteries get compressed. You won't feel it happening. But over time, chronic compression reduces oxygen delivery to these vital brain regions hour after hour. The Journal of Manipulative and Physiological Therapeutics examined how neck angle affects vertebral artery blood flow. Extreme forward bending measurably reduced flow through these vessels. Now apply that finding to 8 hours of sleep every single night for years. I see this pattern constantly. Someone wakes up every morning with neck pain and a dull ache at the base of their skull. They assume it's stress. They assume it's getting older. Then they switch to one properly contoured pillow. Within a week, the symptoms disappear. One pillow, that's the entire intervention. But we're only at number 3, and number 2 is where things get genuinely concerning. Number 2, sleeping in a tightly curled fetal position. This is one of the most common postures, especially among older adults. It feels safe, it feels protective, it's instinctive, but from a physiological standpoint, this position is creating 2 serious problems inside your body every single night. First, your lungs cannot fully expand. When you curl up with your knees pulled to your chest and your chin tucked down, your ribcage compresses. Every breath you take all night is shallower than it should be. You know that feeling when you wake up and your chest feels tight, like you can't quite take a deep breath right away? That's because your lungs have been working in a restricted state for hours while you slept. When oxygen intake drops even 10 to 15%, your blood oxygen saturation decreases. For someone with cardiovascular issues or early lung disease, that reduced oxygenation stresses both your heart and your brain simultaneously for the entire duration of sleep. Second, your neck and upper back stay under constant muscular tension all night. The small blood vessels around your cervical spine and the base of your skull get compressed. Blood flow to your brain decreases. Research in respiratory physiology and neurobiology confirmed that body positions involving significant spinal flexion reduce tidal volume, the amount of air you pull in with each breath, across an entire sleep cycle. That adds up to hundreds of shallower than normal breaths. Someone might wake up foggy, slightly dizzy, maybe a dull headache. They think they just slept poorly. What actually happened is their brain was mildly oxygen deprived for 7 or 8 hours. The adjustment is simple, and I'll show you exactly how to make it. But first, number 1, because this habit combines multiple risk factors into a single nightly routine that could be the most dangerous thing on this entire list. Number 1, going to bed within 2 hours of eating a large meal or drinking alcohol. I know this lands close to home. Evening dinners, a glass of wine to wind down. It's woven into daily life. But from a cardiovascular standpoint, this combination is the most dangerous pattern on this list by a significant margin. Here's the sequence. When you eat a large meal, your body immediately redirects blood flow to your digestive system. That's a normal physiological response, but it means less blood is circulating to your brain, your heart, and your other vital organs. In younger people with flexible, responsive vessels, the body compensates smoothly. In older adults with narrowed or stiffened arteries, this redistribution can trigger dizziness, sudden lightheadedness, even micro-fainting events during sleep that never fully wake you. Now add alcohol to that equation. Alcohol dilates your blood vessels. Your blood pressure drops suddenly. For someone with healthy, elastic vessels, this feels like relaxation. For someone with plaque buildup or arterial stiffness, this sudden drop forces a compensatory response. Your body overcorrects, blood pressure spikes, then drops again. These violent swings stress weakened vascular walls. In compromised areas, clots can form, small vessels can rupture, and all of this is happening while you are completely unconscious. The American Journal of Hypertension studied alcohol consumption and nighttime blood pressure patterns. Even moderate alcohol consumed close to bedtime disrupted the natural blood pressure dip that should occur during sleep. When that protective dip doesn't happen, cardiovascular strain across the entire night increases dramatically. Let me paint you a real picture. Someone finishes dinner at 8 p.m., drinks 2 glasses of wine, and goes to bed at 10 p.m. At 2 a.m., they wake up with a pounding headache, a racing heart, sweating. They assume it was a bad dream and go back to sleep. That wasn't a dream. That was a circulatory crisis their body was scrambling to compensate for. Over months and years, these episodes accumulate. Small vessel damage, microstrokes that produce no obvious symptoms. Then one night, it's not micro anymore. If you do one thing after watching this video, change this habit. Finish dinner at minimum 3 hours before bed. If you drink alcohol, stop 4 to 5 hours before sleep. Add a 15-minute walk after dinner, just movement, nothing intense. That single behavioral change can reduce your overnight stroke risk more than most people realize. What to do instead? Position 1. Left side sleeping. And I want to tell you something that most physicians don't even bring up in appointments. Your heart sits slightly left of center. When you sleep on your left side, gravity assists blood circulation instead of fighting it. Your heart works less. Blood moves more efficiently. Your brain receives better oxygen delivery throughout the night. That's the fundamental cardiology. But here's the piece that changes everything. About 10 years ago, researchers confirmed the existence of the glymphatic system, your brain's internal waste clearance network. While you sleep, this system flushes out metabolic waste products, toxic proteins, the cellular debris that accumulates during waking hours. A study published in the Journal of Neuroscience found that this glymphatic clearance works most efficiently when you sleep on your side, and particularly on your left side. Here's why this matters beyond stroke prevention. Every single day, your brain accumulates proteins including amyloid beta and tau. In Alzheimer's patients, these proteins build up and form plaques. In healthy brains, the glymphatic system clears them out during sleep. But if you're sleeping in a position that restricts this clearance, those proteins begin to accumulate, not overnight, not in a year, over decades. And by the time symptoms appear, significant damage has already been done. Left side sleeping isn't just about tonight. It's about who you are cognitively 20 years from now. There's an additional benefit. The anatomy of your stomach and esophagus means that left side sleeping physically keeps stomach acid down. If you deal with reflux, this position alone can eliminate that burning sensation in your chest by morning. Now, if you've been sleeping on your right side or back for 30 years, switching doesn't happen overnight. Here's the practical solution. Use a body pillow. Hug it in front of you. It keeps you positioned on your left side and supports your spine simultaneously. If you have joint pain, place a smaller pillow between your knees. What about rolling over during the night? You will. That's completely normal. The goal is not perfection. The goal is spending more time in the optimal position than in the harmful one. What to do instead? Position 2. Back sleeping with gentle elevation. Not flat. Not sitting up. A gradual incline raising your entire upper body 15 to 30 degrees. You can use a wedge pillow, an adjustable bed base, or carefully arranged stacked pillows. The critical detail: your entire upper body elevates, not just your head. Why does this work? 3 reasons. First, blood returns to your heart more efficiently from your lower body. If you have poor circulation, swollen ankles, or varicose veins, this position reduces the workload on your cardiovascular system during sleep. Second, pressure inside your skull decreases. For people with fragile brain vessels or uncontrolled blood pressure, this reduction in intracranial pressure lowers the risk of small vessel events, tiny hemorrhages that don't cause dramatic obvious symptoms but accumulate silently over time into cognitive decline and vascular dementia. Third, your airway stays more open. If you have mild sleep apnea, congestion, or chronic sinus issues, this elevation reduces airway resistance and improves oxygen delivery to your brain across the entire night. One detail most people miss completely: if you elevate your upper body, also place a small pillow under your knees. This preserves your spine's natural curve and removes pressure from your lower back. Together, this creates what's called zero-gravity posture, the same principle NASA studied for astronauts. It distributes pressure evenly across your body and reduces strain on both joints and blood vessels simultaneously. Important clarification: this position does not work for everyone. If you have severe sleep apnea, even with elevation, back sleeping may collapse your airway. Left side is better. If you have shoulder arthritis, elevated back sleeping may offer significant relief. If you have heart failure, left side is generally ideal. The point is not to follow a rule blindly. The point is to understand the underlying physiology and apply it to your specific situation, your bedroom environment. Even a perfect sleep position cannot overcome a bedroom environment that works against your brain and cardiovascular system. These details matter more than most people ever consider. Temperature first. Keep your room between 64 and 68 degrees Fahrenheit. A cool environment triggers a drop in core body temperature, which is the signal your brain uses to enter deep sleep. It also naturally lowers nighttime blood pressure, reducing strain on brain vessels across the entire sleep period. If your room is too warm, your body works continuously to regulate temperature. You stay in lighter sleep stages. Your heart rate stays elevated. You never reach the deep recovery phases where genuine physiological repair happens. Blue light after 9 p.m. is the next problem. Phones, tablets, televisions, harsh overhead lighting. All of it suppresses melatonin production. This delays the deep sleep stages where your brain clears metabolic waste and your cardiovascular system stabilizes and recovers. If you absolutely need a device, use blue light blocking glasses or enable night mode. Better yet, read a physical book. Your brain requires genuine wind-down time without photonic stimulation. Proper neck support, which we already covered, one contoured memory foam pillow that supports your neck's natural curve without forcing your head into any unnatural angle. This single change can prevent the chronic vertebral artery restriction we discussed with number 3. Finally, noise. Even sounds that don't fully wake you can jolt you out of deep sleep stages. Your heart rate spikes. Cortisol increases. These are micro-stress events happening throughout the night that you never consciously remember, but your vascular system remembers every single one. A white noise machine or quality earplugs create a consistent acoustic backdrop that masks irregular noise and protects your deep sleep architecture. Track what's happening while you sleep. Your body gives you signals throughout the night. Most people just don't know how to read them. If you want to go one step further than position changes, here are 3 tools worth considering. An overnight pulse oximeter is a small device that clips to your finger and tracks your blood oxygen level throughout the night. If your oxygen repeatedly drops below 92%, that's a serious red flag. Possible sleep apnea, circulation issues, or respiratory problems, all of which elevate stroke risk. The data is directly relevant for any physician evaluating unexplained morning symptoms. Heart rate variability tracking through a smartwatch or sleep ring measures how well your autonomic nervous system is functioning while you sleep. Low overnight HRV signals stress, inflammation, blood pressure instability, and metabolic dysfunction, often well before these problems show up on daytime tests. A simple sleep journal costs nothing. Write down how you feel each morning. Headaches, dizziness, numbness, tingling, brain fog. These subtle patterns, tracked over weeks, reveal information that will not appear in a single office visit. Patterns in a journal have changed the diagnostic conversation for many patients who were told their symptoms were just aging. Absolute critical point. These tools are for awareness and education. They do not replace medical evaluation. If you notice concerning patterns or have persistent symptoms, bring that data to a qualified healthcare provider. Self-monitoring is valuable. It is not a substitute for professional medical care. Why your doctor never told you this sleep position does not fit into a standard 15-minute medical appointment. There's no blood test for it, no imaging study that captures it, no prescription to write. In a standard visit, your doctor is reviewing labs, adjusting medications, addressing acute symptoms. Sleep posture is not on the checklist. This is not a criticism. It's a structural reality of modern medicine. But what research is continuing to show is that sleeping position can silently affect blood flow, intracranial pressure, oxygen delivery, cardiac workload, and your brain's ability to clear toxic proteins across every single night of your life. These are not dramatic single events. They are cumulative processes building night after night, year after year, decade after decade. For anyone over 60, for anyone managing blood pressure or cardiovascular conditions, these nighttime variables become critical determinants of long-term health outcomes. And here's the part that most health information completely misses. You don't need a prescription. You don't need expensive intervention. You need awareness and 1 or 2 targeted behavioral adjustments. Switch to left-side sleeping. Elevate your head 15 degrees. Stop eating within 2 hours of bed. Replace 3 pillows with 1 properly contoured pillow. Any single one of these changes can measurably improve how your cardiovascular system functions during the hours when you have zero conscious control over it. By watching this video to this point, by taking the time to understand these connections, you are already more informed than the vast majority of people who will go to bed tonight in the exact same position they've been in for decades, unaware of what it's doing to their brain and heart. You now have information that could protect your brain starting tonight. That is not minor. That is genuinely significant. Here's what I need you to do right now. Pick one adjustment. Just one. Maybe it's switching to your left side. Maybe it's finishing dinner 3 hours before bed. Maybe it's replacing your pillow stack with a single contoured option. Start there. Give it 7 days. Pay attention to your mornings. Do headaches decrease? Does your energy improve? Does the brain fog lift? Your body will tell you if it's working. Drop a comment below and tell me which habit you're changing first. Your answer may help someone else recognize a pattern they've never considered. If this gave you information you've genuinely never heard before, hit the like button and share this with someone who needs to hear it. Someone over 60, someone managing blood pressure, someone who keeps waking up with symptoms no one has been able to explain. Next week, I'm revealing 5 specific foods that clinical research shows can reduce stroke risk by up to 30%. Not generic eat healthy advice. Specific foods, specific amounts, and the correct way to use them. There's a strong chance you already have 3 of them in your kitchen right now, but you're not using them the way the research actually recommends. Hit subscribe and turn on notifications. If what you heard today was valuable, next week is going to matter even more. I'm Dr. Blake Harrison. Sleep smart, protect your brain. I'll see you in the next one.